Good morning, everyone. So my name is Dr. Leen. I'm a general practitioner based in London. I work as an NHS and private GP and also have my own practice in functional medicine in central London as well. So I'm really excited to talk about MyPro DiaCare today because in practice I prescribe hydration sachets as well as probiotics separately as two different products. And I'm excited to see a product that uses both hydration and probiotics in one product. So I will explain briefly what MyPro DiaCare is and how you can use it to support your body. So MyPro DiaCare, it comes in a sachet like this. It has two chambers. The first chamber is a salt chamber and the second chamber is probiotic chamber. So I'll briefly talk about the salt chamber first. So the salt chamber has minerals, electrolytes to keep your body hydrated. So as I mentioned, in practice, I prescribe hydration sachets to people who are dehydrated or they come in with symptoms such as vomiting, diarrhea, fever, or basically at risk of hydration. And it is a big problem in general practice. So people present with, for example, dizziness, tired, dark urine, or dry, cracked lips, which I'm sure we've all experienced, especially in a weather like this. So just as a show of hands, how many of you drink 6 to 8 cups of water a day? I can see one there, but to be honest, it's a lot more than I expected, mainly because we are all health focused and we know the importance of hydration, basically. But unfortunately, it is a major issue in our community, and about 75% of adults are chronically dehydrated. What that means is that they're dehydrated for a long period of time. So as we mentioned, the sachets, we would advise it for people who are dehydrated or someone who at risk of dehydration. So gastroenteritis is a typical example, someone with vomiting, diarrhea, or fever, they're losing a lot of fluid. I always tell my patients you have to drink plenty. If you're off your food, that's fine, but you need to stay hydrated. Because imagine you're vomiting, you're having diarrhea, you're losing a lot of fluids, and you're not having enough fluid in, that can be dangerous because your organs are overworking. And if they continue to overwork, then you might need essentially to go to hospital just for IV drips. So the hydration sachets come in between to prevent people from going into hospital and keep them hydrated. So a little sip of minerals and electrolytes can work a lot more in keeping your body hydrated. And an important thing to remember is our water makes up 2/3 of our bodies. So imagine how much the water goes to all your organs. And if you are dehydrated, you don't have enough water, all your organs will start to overwork. But we usually start seeing the kidneys overwork first. And we usually see that in blood tests. For example, the kidneys are overworking in a blood test. In weather like this, it's all the time. All my blood tests come in as kidneys overworking. So I always tell my patients, drink water, and we repeat the blood test and it goes back to normal. So the second chamber is probiotic chamber. And that's what makes this product very exciting and unique, because there's usually hydration sachets, and this one has hydration and probiotics, because most illnesses that make you dehydrated can also affect your gut health. For example, we go back to gastroenteritis. People who have gastroenteritis, they're vomiting, they have diarrhea, so they're dehydrated, but also they will start to have microbiomes imbalances in their gut. And people who have gastroenteritis are at increased risk of getting other gut health issues. For example, IBS, you might have heard of irritable bowel syndrome, or IBD, inflammatory bowel disease. So that's when it's important to start the sachets early to give gut health, to support your health, as well as hydration at the same time. So MyPro DiaCare probiotics chamber has a bacteria called Lactobacillus Rhamnosus GG. So lactobacillus is a really important member of your gut microbiomes. There is a huge amount of evidence to tell us about the importance of lactobacillus on the gut health. And to be honest, it's the most commonly used probiotic in all probiotics that you use. You always would see lactobacillus because there's so much evidence just to show its support. But what makes it unique is that Lactobacillus rhamnosus is shown in clinical trials that it stays for longer and persists for high proportions for longer compared to other probiotics, and it reduces the duration of diarrhea. So it's very important to use it early on, or as I just realized as well, it's important to use it for a prevention. So if someone in your family member has got diarrhea or vomiting, you can use a sachet to keep you hydrated, probiotics, and the bugs can come in, the bacteria can come in, sit in the gut and prevent the gastroenteritis from getting to you, basically. So you can use it as a prevention. So just to wrap up, we know that all social media is filled or saturated with healthcare advice that is not always evidence-based. And it's so refreshing to see that MyPro DiaCare uses information that is evidence-based, based on clinical trials, and they're using healthcare professionals to explain to people what the product is. So I hope you know more about MyPro DiaCare, and I'm happy to catch up later if anyone has questions or you want any more information. Enjoy your hot yoga. Thank you.